Are you aware of what triglycerides are and the role they play in your body? Triglycerides are a type of fat found in your bloodstream, and they serve as a valuable source of energy for your body. However, like many things in life, balance is key. When the levels of triglycerides in your body rise above a certain threshold, they can pose a risk to your health. High triglycerides are associated with a number of health concerns, including an increased risk of heart disease, stroke, diabetes, and pancreatitis. It's important to keep an eye on these levels, especially as they're considered elevated when they surpass 150 milligrams per deciliter after an 8 to 10 hour fast. Understanding the role and impact of triglycerides is the first step towards managing your health effectively. So, you might be asking, what could be causing these triglyceride levels to rise? Have you wondered about the factors that can cause your triglyceride levels to spike? Well, there are several culprits that might be behind the rise. First, there are certain health conditions that can cause triglyceride levels to increase. These include being overweight or obese, diabetes, and hypothyroidism. When your body carries excess weight, especially in the belly area, or when your blood sugar levels are not well controlled, your triglyceride levels can go up. Similarly, an underactive thyroid can also lead to high triglycerides. On top of these health conditions, certain medications can also contribute to elevated triglyceride levels. These include tamoxifen, used for treating breast cancer, beta blockers used for high blood pressure, steroids used for a variety of conditions, diuretics used for heart disease, and even birth control pills. But can we do something to bring down these triglyceride levels? Stay tuned to find out. Did you know that the food you eat can have a significant impact on your triglyceride levels? It's true. The choices we make in our diet can significantly influence our triglyceride levels, either pushing them up or helping to bring them down. Let's dive into some dietary changes that can help you lower your triglyceride levels. First off, consider reducing your intake of sweets. This includes candies, cookies, pastries, and other sugary treats, as well as sweet beverages like soda or fruit juice. You see, these foods are high in simple sugars which your body can quickly convert into triglycerides. So, by cutting back on these, you can help keep your triglyceride levels in check. Next, think about alcohol. While a glass of wine with dinner might seem harmless, alcohol can actually boost your triglyceride levels. So, it's a good idea to limit your alcohol intake, and if you're a smoker, quitting can also help lower your triglyceride levels. Moving on to carbohydrates, particularly the refined kind. Foods like white bread, white rice, and pasta can cause a spike in your triglyceride levels. Instead, opt for whole grain alternatives. These are not only lower in simple carbs, but they're also packed with fiber, which can help reduce your triglyceride levels. Speaking of fiber, it's a great idea to include more of it in your diet. Foods like oats, brown rice, quinoa, and legumes are excellent sources of fiber. They help keep you feeling full and can help manage your triglyceride levels. Now, let's talk about fats. Not all fats are bad. In fact, foods rich in omega-3 fatty acids and monounsaturated fats can actually help lower your triglyceride levels. Fatty fish, flax seeds, walnuts, and dark leafy greens are all great choices. Finally, maintaining a healthy weight can also help keep your triglyceride levels in check. Even a modest weight loss can greatly reduce your triglyceride levels. So, dietary changes can be a game changer, but is there more to it? Stay tuned to find out. Scene script: have you considered how your lifestyle choices can affect your triglyceride levels? Let's dive into some crucial lifestyle changes you can adopt to lower your triglycerides. First off, maintaining a healthy weight is key. Even a modest weight loss of 10 to 15 pounds can greatly reduce your triglyceride levels, cholesterol, and heart disease risk. It's not about drastic changes, but rather consistent small steps towards a healthier you. Next, if you're a smoker, consider this another reason to quit. Smoking is linked to a host of health issues, including elevated triglyceride levels. It's tough, no doubt about it, but the benefits to your overall health and to your triglyceride levels make it well worth the effort. Now let's talk about what you eat. Filling your plate with deeply colored fruits and vegetables every day is a great start. These are good sources of fiber and beneficial phytochemicals that reduce disease risk. Broccoli, Brussels sprouts, carrots, red peppers, berries, cantaloupe, watermelon, and more. There are so many to choose from, so find the ones you love and have plenty. But it's not just about adding the good stuff, it's also about avoiding the bad. Specifically, trans fatty acids found in processed foods and saturated fats found in foods like butter, beef, pork, lamb, fried foods, and high-fat dairy products. These fats can raise your triglyceride levels, so it's best to limit them. Instead, use healthier fats like olive oil, canola oil, avocado oil, walnut oil, and flaxseed oil. Remember, it's not about perfection, but progress. Every positive change you make can help lower your triglyceride levels and improve your overall health. And while these lifestyle changes can make a significant difference, it's important to remember that everyone's body responds differently. So it's clear that a healthy lifestyle can help lower your triglyceride levels. But remember, everyone's body responds differently. So you've learned about triglycerides, the factors that cause high levels, and the changes you can make to lower them. But what's the key takeaway here? Triglycerides are a type of fat found in your bloodstream. When levels are too high, risks for serious health conditions like stroke, heart disease, diabetes, and pancreatitis increase. These levels can be elevated due to certain health conditions, medications, and lifestyle habits. The good news is, you can take proactive steps to lower your triglycerides. Start by reducing or eliminating sweets and refined carbohydrates from your diet, cutting back on alcohol, and quitting smoking if you smoke. Incorporate more omega-3 fatty acids and monounsaturated fats into your meals, maintain a healthy weight, and load up on deeply colored fruits and vegetables. Avoid trans fatty acids and limit saturated fats. Remember, it's all about balance and making choices that support your overall health. But always consult with your healthcare provider before making any significant changes to your diet or lifestyle.